Namaskar and welcome to Apollo 24/7's Health Hour. This is a show where we bring you Apollo's expert doctors to the live show where you can ask your questions and queries that you have been postponing for a visit. So here's an opportunity for you to meet our expert and ask the questions on the YouTube chat of Apollo 24/7's YouTube channel. If you're watching this on social media like Facebook or Instagram, please hop on to Apollo 24/7's YouTube channel so that we can answer your questions. And then also on the show, we do give away gift vouchers and discount coupons that can be used on Apollo 24/7. Download the Apollo 24/7 app, which brings the entire Apollo benefits of having Apollo Hospital in your mobile phone. So please do download Apollo 24/7. And also on the show, I promise you that there's a health quiz for which you can win health credits as well. So keep hooked on. I'm going to do these health quiz and the health coupons towards the end of the show. So आज का टॉपिक है hernia. What to do if you have hernia? Surgery किसके लिए है and who has to get what kind of surgery? All these questions about hernia. Today we have our expert joining us in a very short while, Dr. Neel Shah, surgical gastroenterologist, senior consultant general surgery, Indraprastha Apollo Hospitals, New Delhi, with experience of 30 plus years. Dr. Neel Shah can be consulted for hernia, laparoscopic colon resection, gallstone, laparoscopic surgery, and appendicitis as well. And professional memberships of his range from Royal College of Surgeons, member of IAGES, and member of Upper GI Association of England as well. Here's Dr. Neel Shah joining us. Good morning, doctor. Welcome to the show.
Good morning, Jhansi. Welcome to everybody. Have a nice Sunday.
Thank you so much. I always believe that information is power, and while you doctors do so much while treating patients, it's also that you spread awareness and give information, which is equal to power. Thank you so much for being with us on this Sunday morning.
Pleasure being here.
Yes, so as the topic says, screaming loud in the bold letters right on the top of our heads, hernia. What is hernia, and how do we understand the term hernia?
So a hernia is basically like if you have a hole in the wall in your house or in your room. So there's a hole in the abdominal wall through which intestines, internal contents of the abdomen come out and cause through a defect in the abdominal wall, and that is what causes the problems. The intestines are not supposed to be outside; they're supposed to be inside, and then they make their way outside through a defect or a hole, which can be for a variety of reasons, and that's what's called a hernia.
Okay, so I understand that the muscle wall has a hole, and then the internal parts are trying to get out of it. But then there is a barrier which is protecting it out so that it's not exposed.
Yes, so there is, if you look at the abdominal wall, there is skin outside, and then there is the muscle, and then there's the internal contents where the intestine is floating inside. So the hole is in the abdominal wall, which is supporting, which is the muscular wall. And it is through this that there is a hole. It's obviously covered by skin, so it is not exposed. The intestines are not exposed. Right. So
Doctor,
yes, it's outside, but it's
I'm sorry, a non-medical question, but a technical question. Is your YouTube on somewhere or behind you or on your device or something? Because I can hear our live. Is the YouTube channel on, or is the live being beamed on your phone? Because I was able to hear myself.
Yeah, so was I, but no, nothing's on. No. Don't know where that's come from. Sorry about it. Yeah.
Back in team, if you could please do check so that our audience will be able to hear us clearly. Yeah. So Dr. Neel, you were saying that though they have pushed out from the muscular wall, they are not exposed, is what I've understood.
They come through the hole in the muscular abdominal wall, but it's covered by skin outside, so it is not exposed to the air. But the intestines are outside, and then they can cause the problems thereof because of them coming out of the abdomen.
All right, so that's called hernia. And kahan ho sakta hai? What are the areas where the intestines can come out of the abdomen wall?
So there are बहुत सारे type के hernias होते हैं. There are many types that are there. The most common ones are which people would have heard is the inguinal hernia, which is down in the groin. The other common ones are through the umbilicus or the belly button, which is called umbilical hernia. Then there are ones through previous operations that people have done, which is called incisional hernias. Then there are rarer types of hernias which are there, Spigelian hernias, obturator hernias, lumbar hernias. And there is one which is an internal hernia, which goes into the chest from inside the abdomen, which is called a hiatus hernia. So these are the
Oh,
different types of hernias that you can have, and which, like, the different treatments for each one of them.
okay. So, which are the most common ones that are seen then out of the range of hernias that you've just mentioned?
So the commonest hernias which are there are the inguinal hernias and the umbilical hernias. So these are the two hernias which are extremely common, and we see them very often. The third most common one would be incisional hernias, especially in women.
Hmm. So, incisional hernia का रीजन क्या हो सकता है?
So as the name implies, incisional hernia means it goes through an incision. Meaning somebody had
Okay.
a cut in the abdomen in the past and it hasn't healed properly, and then there is a gap in the abdominal wall through which the internal contents of the abdomen come outside. So that's called an incisional hernia. So that's after previous operation or through a previous operation scar.
Right. So, most probably in a woman, if I'm talking about, then it should be the cesarean section, or
Yes, cesarean sections in the old days used to be done through vertical scars. It was very common to have incisional hernias through them. These days they do it through a transverse scar, which we people call a Pfannenstiel scar. It's a lower abdominal scar, right below, and that basically doesn't cut the muscle; they divide it. So the chances of hernia are there, but they are lower, in much lower in the lower incisional scars, which are now the norm these days.
okay, okay. So now the cesarean sections have advanced to the ones that are more horizontal. So they have changed the way that they've started to operate on the deliveries. So hernia ke chances bhi kam ho gaya. That's what I've understood. But now
Yes.
women and men, where is the किसको ज्यादा हो सकते हैं ये hernia? Is there a ratio or is there a percentage which is higher, or is it only men or women?
No, hernias can happen to any age group, can happen to any sex, either men or women. There are certain types of hernias which are more common. For example, inguinal hernias are more common in men, but that does not mean that women don't get them. They do get them. In my practice, in a year, you would see a few women getting inguinal hernias. Umbilical hernias seem to happen with a reasonable frequency between men and women. It's almost equal. Incisional hernias are slightly more, more common in women because if they've had operations and cesareans, older set of people, then they have incisional hernias are more common. So by no means is it that it's more common in one or the other. One particular type of hernia may be more common than the other, in one sex rather than the other.
Right. So what happens if a hernia is left untreated? What if I choose not to do anything about it?
Jhansi, that's a very good question. Is one of the myths of hernia surgery. What do you do when a hernia is left alone? It's a very good question. So, as I had said, that a hernia is a hole in the wall, abdominal wall, and the intestines come outside. What are the things that can happen? One is that over a period of time, they keep getting bigger and bigger. If you can imagine that if you have a hole in the wall at home and you start putting things through the wall and in and out, what would happen? One day, one brick would fall, another brick would fall, and the hole will get bigger. So similarly, when you have a hernia in the abdominal wall, and since intestines go in and out, when you lie down, they go back in. When you stand up, they come out. The hole will gradually get bigger and bigger. So the intestines start coming out. The skin outside starts getting thinner. The other bigger problem is, and here is something to understand also, is that the smaller the hernia, in diameter, they're more dangerous. The reason being is that the intestine comes outside, sometimes the blood supply can get cut off. And then you can end up with an emergency, with what we call an obstruction, or it can even lead to, if a cut off of the blood supply, to a strangulation of the bowel. Strangulation in the sense the blood supply gets cut off and actually the intestine becomes gangrenous. So these are the consequences if you leave a hernia alone and not do it. And you can get into these other complications.
Right. So, is there an age group which is more prone to hernias, or is it only in the young adults, not young adults, or in the younger active phases, or is it the senior ages?
No, hernia can occur at any age from the birth onwards. So there are certain birth hernias which are very common on children when they're born, and they keep going on. Yes, the more elderly people do tend to have more hernias because there is abdominal wall weakness by that time, and there's been a lifetime of working, exercising, moving, so on and so forth, and these things can. So it's more common in the older age group, but there is no age is exempt. So we'll see, hernias from birth onwards till anybody say 90 years old.
Okay, okay. But then the surgical options do vary for these
Mhm.
age groups. The kind of confidence a young person has to the 90-year-old person, and the kind of history that they have, this might be affecting the surgical options, right?
Not the surgical option because the treatment of hernia is pretty much standard except in small children where meshes are not put inside. In the every age group, when once they become adults, once they are over 18, when they stop growing, that is when a mesh is required to be used for repair because mesh is like a brick. It is basically a supporting tissue which is put inside. It's a foreign body material put inside. But yeah, the option, the surgical technique and the surgery remains the same, and so there is no difference in that. But you would tend to try and do surgery which is as minimal as possible if somebody is very old, obviously, and you would tailor, and the surgery is also tailored to the fitness of the patient. So if the patient is not fit, then one has to then balance out the advantage of doing the surgery versus the disadvantage because of health reasons.
All right. So before I ask you my next question, Dr. Neel, just give me a second. Mr. Dasari David, I did spot your question even before we started the show, but currently I'm not able to see your question on the chat. May I request you to type the question back so that I can place the question before Dr. Neel Shah. To continue, I remember one of my friends who had this kind of hernia in the lower abdomen or somewhere between the belly button and the lower abdomen, and she used to push it in and out. She kind of, she used to say that, "नहीं नहीं, अभी मेरा ठीक हो गया है." So is that
Mhm.
true? What happens with? I'm not sure if that's the right way to handle it.
No. So, okay. The thing is that a hernia which can be reduced, we call that a reducible hernia, which can be pushed back inside the abdomen. So that basically goes to show that it's not an obstructed hernia. But that is not the treatment for a hernia, because as I explained that if a hernia stays outside for too long, and it can get sometimes it then gets stuck to everything outside, and then it can cause an obstruction. It can start narrowing. All these things can happen. So once you have a hernia which is formed, there are no stages of a hernia. It's either there or it's not there. So once if it is out, it ought to be repaired because it's only going to make it. It's going to keep getting bigger gradually over a period of time.
Right, so that is not the way to handle it. So, hernia in most of the cases is pain free. Am I right in saying that, or does it also cause some pain or discomfort?
No, many hernias are pain free, but no, there are painful hernias, and that painful hernia is a sign. So hernias, when they form or when they are enlarging, they tear the tissues as they get bigger. So suppose somebody has a hernia, and then they do a lot of severe exercise, say lifting heavy weights or something. Some people will tell you that they felt a tearing sensation, they felt a painful sensation in their hernia. That is because the tissues around it have been stretched and they've torn a bit, so they'll get the pain then. The other reasons for getting pain is, as I explained, that if the hernia contents or the intestines or whatever has come out gets stuck outside and the and the intestine gets cut off, then it becomes painful. Or if the blood supply starts getting a clot, it'll get painful. So pain is a sign which is not to be ignored. Pain is a sign that things are not going in the right direction and that something needs to be done pretty quickly.
So, pain is a warning sign. And what else around hernia is a red flag that you need to meet? And when does one understand that the hernia has started to happen? And what's the first
Okay, so
ever consultation? Which should be the right point?
yeah, good question. So the first indication will be done by the patient, right? I know we have a lot of health checkups, and I do pick up hernias in health checkups, but they did not know they had a hernia. They're the really small hernias. But most people will notice their own hernias. They will notice a bulge coming out. Okay, many young adults who are exercising regularly, doing a lot of things, playing games, playing sports, will suddenly find that there is in their groin, which is in men, it's very common, or in the belly button. It's now, instead of the belly button being inverted inside, it's like pointing outwards. It's like, it's the other way around. So these are the things. So they will pick it up themselves that I have a gap out there, or suppose I've had a surgery in the past, and in the scar they find that there's a bulge which is sticking outside. So most people will pick up their own hernias. Few will be picked up in health checkups where people are not aware. And we one part of our checkup is to look for hernias, and we do pick up some that way. But most people will actually pick their own.
So you got to understand your own body. क्या changes हो रहा है? And if I've noticed that there's some change or there's some kind of pain, so the change, physical change happens first, or is it the pain which precipitates first or shows first?
Either or. It depends. Sometimes, if you might, if people who go to a gym know that there are hernia belts lying out there, right? These are rather belts which are there, hernia belts as they're called. So people who pick up heavy weights, they have to wear a belt so that they don't get a hernia. And you'll find it in every gym; it will be there. So somebody who's going to a gym regularly, and I know a lot of people do that these days. There's the people becoming more fitness and health conscious. When they lift a heavy weight, sometimes they will feel a giveaway and pain, and then they know a hernia has popped out. But mostly, like I said, no. It develops for whatever reason. These are congenital weak spots, like in the inguinal area, umbilical area. These are spots which are congenitally weak in people, and that is where the hernias most likely form.
Right. So, gym के बारे में अभी आपने जो बताया, which suddenly caught my attention. So, while they say that exercising is very important and lifting weights is very important for building muscle mass, or for women who are entering into their 40s and 50s, and men not lose their muscle, all this is important, and then lifting weights is important. But does lifting weights cause hernia?
Again, one has to be sensible about this, right? So, in the sense that anything in excess, whether it is food, whether it is exercise, or basically anything in life is bad for you if you do it in excess. As long as you do it in a graded manner, as long as weights are very important, as you say rightly, and especially people and women and men as they're getting older, to maintain muscle mass. So, must exercise, must do weights, but not overdo them. Not like lift 200 kilos. No. Okay. So, and also not do it suddenly. If suppose somebody were to start weight training in a gym, then start gradually, go lower weights, and then gradually increase in weights as your muscles get stronger, and not give it a sudden jerk, and then you then can get hernias, for example, since we're talking about hernias right now.
Okay, so now as you said, abdominal का wall जो है, जो muscle wall जो है, वो weak होने से, छेद पड़ने से, so it becomes weak and then thereby creates a hole. So what makes my muscle wall go weak? And is it only exercise, or is it laxity, or is it as you said, the cut that was incision that was made through because of a surgery? What causes that?
So, good questions. So let me take them one by one. All hernias come through a potentially weak point in the abdominal wall, right? So, for example, in the inguinal areas, this in men especially, the testes are inside the abdomen in the last 4 weeks. They come out of the abdomen when the child is inside the womb of the mother. And then along with it, it pulls the internal lining along with it, which then closes in the last 4 weeks. So this is a potentially weak spot. The other weak spot, as you can understand, is where the umbilical cord is attached to the child, with the mother and child. So that is again a potentially weak spot, because vessels and all sorts of things inside, and intestine, whatever goes inside, which connects with the baby, with the mother, which helps in nourishing the child. So that is again another weak spot. Another weak spot, which is where the food pipe enters the stomach, the abdomen, and joins the stomach. So that's the internal hiatus hernia that I was talking about. So one is that these are the potentially weak spots. Whenever there is pressure on that, now when you walk, when you get up, when you exercise, when you cough, or any of these things, they will put pressure on the potentially weak spots. Not everybody gets a hernia, but these are the points where the hernias come out. So that is one. The other thing is, as one gets older, the muscles become weaker. When the muscles become weaker, the support systems around that go. And again, around these weak spots, the hernias can form. A third thing is that people who are unwell, people who are diabetics, who are obese, okay, who have kidney disease, these people are the ones who, again, they have weaknesses in their body. The body is weak, and hernias can form. There is so people who have chronic cough, smokers, because they cough a lot. That puts, again, a lot of pressure on these weak areas. Right. So, and then the third thing that you were saying is about the incisional hernia. In incisional hernia, the people who had surgeries in the past, जो operations पहले हुए हैं, जो भी हम जोड़ेंगे as a surgeon, whatever we stitch together, वो ऊपर वाले ने जो बनाया है हम नहीं बना सकते. वो strength नहीं आएगा. A scar is always weak than a normal thing. If I were to make a cut on the back of somebody's arm and stitch it up, after 20 years, if I were to stretch it apart, it will tear from the point where the scar was previously there. Yeah. The scar is never as strong as a normal skin. So again, in the abdominal wall, if there is a scar, it is a potentially weak spot.
As applied. Sorry, doctor, I did overlap you there. Just like the fabric.
No.
And you have made stitches. The moment you apply pressure on the fabric, the textile swatch, it's going to tear where you have made the stitches.
Absolutely. So it's absolutely the same thing. And, we are kind of tailors, surgeons. So when we stitch it together, it's going to be potentially always weak. So that is one point from where hernias can reform.
This is quite interesting. So one has to have a good abdominal muscular strength. But agar pedaishi, if by birth one has some kind of weakness, and will I be able to address that, or am I prone to hernia?
Well, we made a lot of advances in medicine, but unfortunately, we cannot predict who will get a hernia and will not get a hernia. There are genetic reasons. There are some people it runs in families, and like I said, then there are the other conditions which can lead to a hernia. But why a hernia forms, or especially, say, for example, inguinal hernias, there are groins on both sides. There's a left groin and a right groin, and why would one get it on one groin and not the other? Is really nobody knows. Though, however, having said that, the right inguinal hernias seem to be more common than the left ones. But again, no idea why. Nobody knows why one would get it and somebody would get it, somebody wouldn't.
All right. Now I move on to the questions of treatment. How and when should I get myself treated for hernia? Are there any non-surgical options for hernia?
Okay, that's again a very good question. It's a myth of hernia surgery. When should you get it done? Now, like I had said earlier, that hernia, there are no stages of a hernia. It's either there or it's not there. For example, in breast cancer, you have stages, or in, say, prostate, you have stages, or in piles, you have stages. There are no stages in a hernia. So it's either there or not there. So essentially, if you have a hernia, it ought to be repaired, because it's only going to get bigger as time goes on. And there's always a danger of, that it might get stuck and cause further complications and all that. As far as, sorry, what is the other thing that you asked?
When should I, as early as possible, or when should I get it done? And non-surgical treatments?
Right. Just a non-surgical. No, there is no non-surgical treatment for piles. In the days gone by, people did use hernia belts, which we do not recommend anymore. In fact, they can be dangerous. Especially, a lot of elderly gentlemen would use inguinal hernia belts, as they were called. They were very popular years ago. But, sometimes with the hernias outside and it's a tight belt, it can actually cut off the blood supply and cause problems. So the essential treatment for a hernia is surgery. There is no non-surgical treatment for that.
Okay. So Mr. Murli Nagesh, you are asking us to translate in Telugu. Dr. Neel Shah will not be able to speak your language, but I will be able to speak your language. Do ask your question. మీరు తెలుగులో క్వశ్చన్ అడగండి, డాక్టర్ గారు ఇంగ్లీష్లో సమాధానం చెప్తే నేను తెలుగులో మీకు ఆన్సర్ చెప్తాను. That was in my language because somebody was asking an answer in Telugu from you. I asked them to type a question in Telugu or English. I will translate the answer for the person who's asking the question.
Sure.
So yes. Now, are there any medical supplements or medicines which can help me? Something like अगर मेरा swelling है या muscle ache है, मैं कुछ pop in करती हूँ. So can I take some tablets to take care of my hernia?
There are no tablets to take care of a hernia. Obviously, if it is painful, anybody or any painful condition, you would take tablets. But as I said earlier, that pain is a warning sign. It is a sign that you need to get it looked at. It's important to go to a trained professional to let them see it and then to advise you as to the treatment which it should be treated. So, but there are no medicines to, how do I put it, to aid a hernia, no.
Okay. So it's no non-surgical treatments, no medications available. Then what are my treatment options?
So the treatment often is a repair. Like I said, it's a hole in the wall. So if you had a hole in your wall in your house, what would you do? You would brick it up, right? You would put bricks to close the hole. Similarly here, we need to close the hole, and the way to put the bricks is we put a mesh inside to seal the hole. A lot of people ask a question, why a mesh? Why a foreign body? They don't like a foreign body to be inside. And the reason being if you try and close that hole, because of the mechanics of the body, it tends to spring open. So the hernia will recur. It will come back. So the way to do it is to repair it is to put a mesh inside and seal the hole inside. The hernial mesh becomes part of the body within 5 to 6 weeks. That is when we tell people not to exercise, not to do a lot of stretching, pushing, and all that, to let the hernia mesh become part of your body. So the treatment is surgical, is into putting a mesh. There are many ways of doing it now. There are open techniques, there are laparoscopic techniques to do it. And laparoscopy is obviously the improvement on the old open operations. The reason being is recovery is faster, pain is less, mobility and return to activity is quicker.
Incisions are less. Yeah, the smaller
holes, quicker recovery, lesser pain, lesser complications of chest complications and all that, and return to work and activity is fast. In today's modern day and age, it's very important for people to get back to what they were doing, whether it is women doing their housework or men going to, or women for that going to work, their offices. It's important to get back and be back to as normal as possible as quickly. So that's the improvement in laparoscopic surgery.
Wonderful. So laparoscopic surgery gives me an opportunity of getting back to my whatever work that I do in a shortest span of recovery time. But what is that? What is that the short span that we are talking about? Is it 3 days? Is it 5 days? When can I get back to my work?
So what I tell my patients who have had laparoscopic surgery, see, typically, if I were to operate, say today, most people will go home the next day, right? So they would, and yes, and most people would have, stitches which are dissolvable under the skin. So they typically come back 5-6 days later to have the tapes removed. Okay, the instructions they are given is not to lift anything more than 5 kilos for the next 6 weeks, not to do any form of exercise. They can walk as much as they want to, as much as they feel comfortable doing. They can climb stairs. It's a very common question. Can I climb a stair? I live on the 3rd floor, 4th floor. I say yes. There are no problems in climbing a stair. But not lifting weights. If you are exercising, you're playing a game, a sport, cricket, golf, whatever, or if you're lifting anything heavy, that is not to be done. Typically, things like driving a motorcycle, if it is, kicking the motorcycle thing, not to do that for at least 4 weeks. If you're driving, I only say that if you are comfortable and if a child is crossing the road and you think you have the control to stop the car in a hurry, please do. But till such time, be careful. So these are some of the simple restrictions that are there. Mostly not. So if people who are working in a desk job or something, I tell them whenever they're comfortable, they think they can sit for whatever the number of hours they do, 5-6 hours, which they can try at home before, and they are welcome to go back to work whenever they feel comfortable doing.
So that gives me another important question. So, if I'm not supposed to lift weights for the first 4 or 6 weeks of hernia surgery, so am I also not supposed to lift weights if an untreated hernia is coming out of my muscular wall? If the hernia is
Yeah. Okay. Again, a very good question. The one is, okay, so as far as the surgical part goes, not to lift it, as I had said earlier, is for the mesh to become part of the body, that it doesn't disturb, it doesn't move around, because you do any lifting heavy weights. Before surgery and when you have a hernia, if you're lifting weights, as in uh, pressure on that hole which is there, even if you get up, even if you cough, even if you move, there's going to be some pressure. But I mean, if you are kind of going to the gym and lifting heavy weights, no, please stop that. Get your hernia repaired and do your weights and all that afterwards. Most people will not lift more than 5 kilos in a routine daily lifestyle, right? You carry a briefcase, you carry a bag, maybe a shopping bag, or ladies carry their own purse around. These are not 5 kilos. They're 5-8 kilos, something like it's nothing. There's not a lot more than that. However, people who do any labor or workers who are working and I don't know, they're using manual labor, whatever. Yes, they should not be doing a lot till their hernia is repaired, until that so-called 5-6 weeks gets over, and then they can go back to doing what they're doing.
Right. So the mesh that you were talking about, what is this mesh? मुझे अभी mesh के नाम से ना iron mesh की याद आ रही. क्या material से बनती है? And then how does it, as you said, get gelled, or what happens of it in my body?
Okay, Jhansi, that's a good one. So mesh is what it says. It's a mesh. It's like jali. That's exactly what it is. But it's made out of what is known as polypropylene. It's which is the simplest mesh which is there. There are many types of meshes out there. There are polypropylene meshes. There are composite meshes. Composite meshes are ones that part of them dissolve. So the function of a mesh is that it produces a foreign body reaction. It makes the body make tissue out there, healing tissue out there, so that it becomes like a solid thing, so that it like kind of recreates a firm to hard wall out there. So that is what a mesh does. And there is ingrowth with the mesh in the jali. There's ingrowth of fibrous tissue, which makes it strong, and so that is what then repairs the hernia.
All right. So it is your own body which is adapting the mesh and then building its fibers around. This is so interesting to learn.
Not the whole body, in that area. In the area where the mesh is put, the body produces a reaction. Yeah, it produces a reaction. There's fibrous tissue which grows out there, and the fibrous tissue is the hard tissue, like your tendons and all that. That's all fiber. So it creates a tissue which is hard, which basically seals the hole, and it prevents whatever inside contents coming outside, and repairs the hernia. So that's what it is about.
Another basic question I'm going to ask you. Please don't laugh at me.
Sure.
No. अभी we hear of surgeries like rods डाले गए हैं, metal के कुछ bases डाले गए हैं, orthopedic surgeries में कोई injuries में थोड़े सालों में उसको निकाल दिए जाते हैं. ऐसे ही ये mesh को भी निकाल दे सकते हैं, या इतना सारा जो growth उसके ऊपर हो गया है, या वो अपने body में अंतर्भाग बन चुका है, now how will we be able to remove it? Do we even have to?
So no, a mesh does not. The mesh does not need to be removed. The very purpose of why it was put in was to create the fibrosis. So if you were to remove it, you're basically removing the brickwork that has been done. You're removing the repair. So it becomes a part of your body. There is no metal in it, right? So it's not anything which is. In the times gone past, we used to sometimes use metal staples in laparoscopic surgery to hold the mesh. Some people still do it. Mostly we don't. Now we use our staplers, or tackers as we call them, which holds the mesh in place, is made out of dissolvable material, which takes 7-8 weeks to dissolve, in which time the mesh becomes part of the body. But some people still tend to use the metal tackers And just to tell the public that and another very common question that people ask is that I'm going through a metal detector at the airport. What happens then? These
Ah,
metals are too small. These metals are too small, and they're made out of titanium, and they do not alarm the airport system. So there's nothing to worry about that. But increasingly,
a
we're not
chocolate
using the
wrapper.
metal.
Just day before yesterday, a chocolate wrapper, a chocolate
Yeah,
wrapper in my pocket had raised alarm. So,
really.
so
Okay.
yes,
Well, I suppose that
yes.
that's probably the chocolate wrapper must be. I don't know what metal that is, but the metal that is used increasingly now, and especially in the surgical, I mean, general surgical line of work, is made out of titanium, which does not set alarms off at the airport. So not to worry.
Thank you, thank you. That gives a lot of assurance. Now, for the timing of the surgery, जैसे आपने बताया था कि diabetic and obese people or people with other problems or pre-surgical or surgery care history, all these can be a reason or a cause for hernia. So what happens if there's a person with diabetes? How does one prep or plan for a hernia surgery?
Right. Okay. Good question. If any patient who's going in for a surgery will have a pre-operative tests done, and especially somebody who's diabetic or a known diabetic, you want to see the diabetic status. The reason you want to see that is that in an uncontrolled diabetic, the chances of wound infections are very high, and even healing is also not good. So you would want to optimize their operation and post-op recovery by getting the sugars under control. So that's important. So that is one of the reasons why pre-operative tests are done, and you do and find out what if there are any conditions that you may not have known, or if you do know, you want to find out the status of that, because it may affect both recovery and healing. So any timing of surgery is dependent on your fitness. So if you're say to operate on a 90-year-old, then you're likely to have heart conditions at that time. So you need to make sure that they're able to withstand that surgery. So there are heart checkups done. Cardiologists will have a review them and see and then assess the surgical risk. So again, the younger you are, the chances of having other illnesses are lower. So fitness for surgery is quicker, faster, and pretty much younger people can get that surgery at any time. Of course, provided that their pre-operative checkups are normal.
Yeah. So while you were also mentioning earlier, Dr. Neel, you were saying that hernias do get picked up at a general checkup or an annual checkup. How do you even spot them? Is it like physical evaluation or any abdominal scan or something? Is there any way that I can test myself?
Well, I mean, hernia is essentially a clinical diagnosis, right? So it is by manually examining a patient to be able to see that. We went through this pandemic, and a lot of doctors were doing online consultations, as I was. And the biggest problem in an online consultation in a surgical patient is that you cannot examine. Okay, and to examine is how you would detect a clinical examination or a physical examination is the best way, and the probably I would say must be done for diagnosing any hernia, right? Unless, of course, there is one which is you can actually physically see it's a very large swelling which is coming outside, which can't be
Correct.
missed, which we call a spot diagnosis. It's a different thing altogether. But the smaller hernias, the ones where you need to, examine, they're best done by examining. So again, anybody who thinks has a hernia, suspects has a hernia, must go to their doctor. That would be the one way to confirm one way or the other. I have had people who have come to me who they think they have a hernia, was told by maybe somebody that they have a hernia. I examined them. I said, I can't find one. Please go away. You don't need anything done. If you, however, get a swelling, do come back and we will see. Or come back whenever you think you have a problem. So best way is to go to a doctor, to a surgeon, and get it examined. And a surgeon,
All
actually,
right.
to get it examined.
Yeah, and a surgeon. Yes. Who does this? Would have been my next question. Who do you consult when you have hernia or you suspect that you have hernia? Then, as you answered, it's a surgeon. It's a general surgeon.
Yes. Yes.
Okay. All right. So my next question would be like, like how a mammogram detects a cancer very, very early and very tiny. Is there anything that can pick up that my muscle wall is weakening and there's a chance of hernia to pop out?
No, there are no tests which can actually predict that a hernia is going to form. Yes, I know these ultrasounds and CT scans, if they were done, they're not done to pick up a hernia. Sometimes a scan, an ultrasound is done for either a part of a general checkup or to see for something else. And sometimes they will find a hernia out there which was not detected earlier. That can happen. I do not get any ultrasound. I mean, like I said, it's a physical test. So if you test and you find a hernia, you found a hernia, you really don't need an ultrasound to do that. But an ultrasound sometimes, or a CT scan sometimes, do pick up the hernias if they were especially done for something else.
Yeah, because the first question that I saw, somebody's question, Mr. Dasari David's question, was mentioning ki one of their scans had shown a 4 mm, something like a fat hernia. He's a 66-year-old male. I'm sorry, I
Sure.
am not able to see the question again, so I'm just recollecting the data that I had seen earlier. So, are
Yeah.
hernias or also made up of different kind of material? What is coming out of the abdominal wall? Like he was
Right. Okay.
mentioning something like.
So fatty hernia. Yeah. So
Uh-huh.
the abdominal wall, like in all of us, has got fat. Okay, there is fat inside, there's fat outside. So there are some, especially the smaller hernias, like for example, umbilical hernias or epigastric hernia, which means above the belly button. They're called epigastric. Epi means above, gastric means, umbilical is above is epigastric. Okay, infraumbilical will be the ones below, infra being below. So epigastric hernias, these are quite a number of them are fat. They have a fat content inside. There is a breach in the wall, and then the fat inside the abdomen makes its way outside. Then you can have actually an empty space outside for where the intestines go in and out. Then there is something called an apron of fat inside, which is called omentum. It's an omentum. It's an apron of fat which is attached to the large intestine and the stomach. Right. So this is what we call the policeman of the abdomen. Wherever there is infection, inflammation in the abdomen, the omentum goes out there to seal it off to prevent the infection from spreading across the abdomen. That also tends to go because it's a loose lying fat, an apron lying inside. It tends to go inside the hernias. It tends to get stuck inside, and then they become either reducible, non-reducible, or depending on the size of the hole. So there can be no contents. There can be contents inside. There can be fat in the abdominal wall that goes inside, producing, as somebody wrote to you, as a fatty hernia. So these are the different things that can be there in a hernia. Essentially,
Yeah.
all of them is a breach in the abdominal wall. That's what they are.
So the surgery and the options of treatment would remain the same for all of these, or are there different ways to treat different hernias?
No, the surgery is exactly the same. It is, you have to close the hole, either completely close it, stitch it across, or by using a mesh, whichever is the most appropriate way of doing it.
Okay. So how and when is it an emergency surgery? Will this hernia ever lead to lead to an emergency kind of situation?
Yes, as I said, as we discussed this earlier, that the intestine comes outside, gets stuck, causes the intestine to shut down. Then the patient will start vomiting because the intestine, the stool will not go further. That becomes an emergency. If the blood supply gets cut off, it becomes a strangulated. That means it'll become red and extremely tender and angry looking. That will require an immediate surgery. You could have a loop of gangrenous bowel loop inside, in which case you actually have to cut the piece of intestine off and join it together. So there are so many things that can happen. I've had to also divert it and bring an intestine out from the side because it was a large loop was lying outside, was gangrenous, and it was not possible to join it and that together. So these are all the emergencies that can happen. Anybody who has a quiet hernia, which I mean is not painful, which is the norm, most of them, 80-90% of them will be like that. The timing of surgery is, as I tell everybody, that there is no emergency to get it done. It's important to get it done. If you have something important happening in the family, or if you're having a wedding in the family or important business deal or something, and you want to get that over, get it over with, and come back and get it done with the proviso that should you have any trouble in the interim, should you have any pain, or if it, and I said you will know. I said, but, so then they'll ask me, okay, how would I know I have a problem? I said you will know. You will know because it'll become painful. It'll become obvious that I need to get something done, and then come back to me immediately. Don't waste your time, and then we'll go ahead and do it. But otherwise, and then I say another thing also. I said, there's never a time in life where I'm doing nothing. Let's get an operation done. You have to take time out. So get it done
Well
and
said.
get the operation done.
Yes, you have to prioritize and then make sure that your body has enough ample good time to heal first and then let you do other works that you are supposed to do. Wonderful. Another question. How long should while I prep for my surgery, what are the things that I need to keep in mind as I'm preparing for my surgery? Is it my diabetes?
Ah,
Is it my weight? What do I need to take in control?
okay. So number one, of course, is that you have to first come to your decision in your mind that you want to get the operation done. So that is one. Second thing is any other medical conditions that you have should be under control. That could be your thyroid, could be your diabetes, your blood pressure. Any of these things must be under control because if you come, say, with a blood pressure of 200 by 130, we won't be able to operate. So, they have to be brought under control. If you come with a blood sugar of 400, we can't operate. So we need to get that under control. So one is doing that. If you're a smoker, ideally you shouldn't be one. But if you are, we said that at least give it up for 5 days before you get your surgery done, because that has seen there have been reports, and in that the lung condition improves even in those 5 days. And since you're going to be under anesthesia, frequently you'll be under a general anesthetic. So you want your lungs to be at its premium, and including post-operatively as well. So so some of the things, general health, look up whatever conditions you have, get them under control. Smoking, try and give up 5 days before. Mentally be prepared and happy. Understand from your doctor what the operation is going to entail, how long it's going to take, how long you've been. So there are no surprises for you. What happens after the operation? Discuss that with your surgeon, and I'm sure then you would have a smooth surgery.
Great. So, what about the recurrence? You were talking about recurrence as well earlier. So, एक बार
Yeah.
जब मैं सर्जरी करवा लेती हूँ, तो मेरे chances of recurring from the same site क्या है और a new site क्या है?
Recurrence is always possible. There is no zero recurrence in surgery. But however, if operation is done properly, done well, the chances of recurrence are depending on which one. For example, in inguinal hernias, proper mesh repair that is within, the chances of recurrence are 1 in 10,000. So very, very minimal, small one. Umbilical hernias would be very similar. The ones who there are some people who have unfortunately had multiple surgeries, okay, and the abdomen for one reason or the other. And they are the ones where the chances of recurrence are very high because, again, the abdominal wall has become weak. There is a lot of scarring there, and the chances of recurrence are high. Obesity, for example, chances of recurrence is high because for somebody is that large, and it's causing that much of a problem. So recurrence is always there. Recurrence is always a very, very, very small possibility. That is not a reason not to get it done, but that is something that people must know that while it is very close to zero, it is not zero. So it can happen.
Correct.
The way to prevent from hernias from recurring is to follow your doctor's advice. If he tells you not to lift things for 6 weeks, please don't do it. Please do not exercise. It's a very small time in life to pay for by not exercising. I have had young patients uh, who have been very active and very involved in exercise and gymming and all that, and they don't like the fact they're not doing anything for 6 weeks. But when I tell them that, listen, it's going to come back, or it might come back if you sort of start too soon, then so that's one thing, is to follow your advice. Give it the body to heal, because time must be given for the body to heal. If the body heals, once it's healed up, and healing comes to an end at about 6 weeks, then you can pretty much go back. And again, when you go back to normal activity or exercising and all that, take it in stages, not 0 to 100, 0 to 10, 10 to
Yeah.
20, 20 to 30. A gradual return to whatever you are going back. And also to assure everybody that they would be able to go back to whatever they were doing. Not a problem. As long as it's done in a graded, in a careful, in a sensible fashion. And number three, and most important, is listen to your body. If your body is giving you pain when you're doing something, don't do it, because this will go away in a period of time. That means you're pushing it beyond a point where you shouldn't be doing it.
Right. So here, Mr. Dasri David is back with his question. 67-year-old, diabetic and hypertension. Abdomen ultrasound in December last noted a 15 midline defect noted at umbilicus with herniating of properitoneal fat. Please advise.
Okay. So, so what he basically has, a 15 hernia, is it's not a very small one, not a very large one. It's an umbilical hernia, as I said. It has some preperitoneal fat. That means there is some fat in the abdominal wall which has gone inside. Okay. So it is a hernia. He probably has it sticking outside a bit, or if he coughs, he must be finding that it bulges when it comes outside. So yes, it is a hernia. He's 78. Did you say 78?
67.
67. Okay, so he's 67 years old. 67 today is not very old. And he's diabetic, hypertensive. Where I am, most of our patients have these problems. So that's not a reason not to do it, as long as it's under control. And I think, if it is, if he finds that it is bothering him, either physically or mentally, get it done. Get it done outside. I mean, I don't know. Again, I haven't seen it to say is it bulging outside or not. Or is it just picked up in an ultrasound? Whichever it is, I don't know. But I would advise them to get it examined physically by a doctor, and then he will be able to then sort of see what exactly he himself will be able to see what he has, and then he can take a decision to get it done. The smaller hernias, as I again said, are the dangerous ones. They're the ones that if intestine gets outside, they can get stuck, or a knuckle of bowel can go inside and can cause problems. So these are the things that can happen. The big wide hernias, the huge hernias, like people who have incisional hernias, they do not tend not to go into intestinal obstruction. They are just a physical size which is very large, which is why they're repaired. So to answer the gentleman, please go to a doctor. Please go to a doctor and get a surgeon and get it checked out.
All right. So he's been a regular viewer with our show as well. So I hope he has enough information to take care of his health, and he would definitely do something about it. Let me ask you one more question about women and hernia surgeries. What if somebody is pregnant and found out that they are with hernia? Should they be waiting till they complete their pregnancy?
Absolutely. As long as they are not having any problems with the hernia, you do not want to disturb a pregnancy. The safest time to operate, if one must operate, is in the second trimester of surgery. So in the middle 3 months, right? So that is a safe time. But that is not a time to do a hernia surgery for a variety of reasons, because an important part of, like I had said about a hernia surgery, is to put a mesh. When you put a mesh inside, and then they're going to have probably may end up having a cesarean section, and that is when the mesh can cause problems and it can get stuck. So, in a lot of women do develop hernias during pregnancy because of the pressure of the fetus inside and the abdominal pressure. But as long as there is no intestinal obstruction or no emergency, which then of course emergency is an emergency, no matter when it has to be done. But no, an elective repair for a hernia should not be done during pregnancy. Let them get over their pregnancy. In fact, I would even also say a step further is that finish your family. Even after you've had your delivery, if suppose you have another child, please go ahead, have another child. Okay. And because since we're putting a foreign body inside, you don't want all that inside. Finish your family, get the hernia repaired.
Right. That's a great advice, doctor. And how about children? Quick word about children and hernia surgeries. And what age should they be going under the surgery, or is there a time that the child has to grow up and then go for a surgery?
No, so again, there are children who will have hernias. Some of the commonest hernias are inguinal hernias in children. They can be operated at 4 to 6 weeks from birth, which would be a good time to operate them, get rid of the hernia. There is no mesh required at that age because the child is growing and tissues are growing. So you don't put a mesh in that case. So it's just a hernia is repaired. Many umbilical hernias will become normal as they keep growing. So you don't need to do an umbilical hernia, and you wait till the age of 4 or 5 before you decide to operate on them. But yeah, I mean, even children like they have and inguinal hernias are very common in children, especially boys, and they can be repaired in between 4 to 6 weeks after birth. Not a problem,
Right.
and frequently
Here's
they are.
Ramya. All right. Ramya is asking this question. Ramya Nagraj, would a hernia repeat itself? Uh, yeah, recur. Basically, that's
The
what she's
recur.
asking.
Yes, any hernia can recur. But like I said, a properly done hernia, done properly and followed up properly, it shouldn't recur. The chances are minimal, but virtually approaching zero.
Correct. So, surgery होने के बाद, if my mesh and all the others, are there any other complications? If I'm treated for my hernia, there is a mesh inside. Can I expect or suspect, or should I be prepared for some complications further?
Okay, so like any hernia or any surgery, sorry, okay, and in any surgery, uh, you can have. I mean, there are complications which are generally associated with any operation that can be there, like bleeding or infection, and all these things can happen. You can one of the disasters of hernia surgery is to get an infected mesh. Again, if it's done properly, proper sterility is followed during surgery, it shouldn't happen. Uh, Otherwise, the other complications of the mesh is of a hernia mesh surgery is that is a recurrence. That the mesh is moved and the hernia has come back. Uh, Pretty much long term, that is the only complication that a hernial mesh can cause. But otherwise, any surgery, whatever complications can be associated with any operation, can be there in a hernia surgery.
Sure. So I think with that I've covered most of the topics, but the most important being that you shouldn't be ignoring your hernia. You should you shouldn't be
No,
postponing your surgery.
no, you shouldn't. You should one. You should. You suspect you have a hernia. Please go to your surgeon. Number two is that if you do have a hernia, and it's obvious that you have a hernia, get it done.
Uh,
A hernia
so I think,
does not develop.
sorry, let me interrupt you here, Dr. Neil. I think
Yes.
we should sum it up in the top tips. I think I should hand it over to you for top tips so that we can give everything
All right.
encapsulated in the top tips. Yeah, top tips from Dr.
Sure.
Neel Shah.
So top tip number one: you suspect you have a hernia, please go to your surgeon and they get it diagnosed correctly and ask for your options. Number two, top tip is please do not postpone surgery too long. It may not be an emergency to be done the next day, but it should be done at some point in time to prevent any problems of complication or to them increasing in size. And the top tip number three is that if you have any pain in the hernia, do not ignore that is a very important warning sign that there's something is not right. And you must again get it examined very quickly and get it resolved as soon as possible.
Yes, wonderful tips there. And it was a great session. I am empowered today. I have so much information. Thank you so much, Dr. Neel Shah, for joining us today on the Sunday morning.
Thank you so much, Jhansi. It was a pleasure talking to you and to whoever's been listening. And I hope I've been able to convey some sense into this topic. Thank you very much.
Thank you again. So, coming up is a health quiz as I take leave from Dr. Neel Shah. Please do answer the questions over chat of YouTube chat, and winner's name will be announced towards the end of the show. And if you are taken to be if your name is taken to be the winner, do write back to us at marketing@apollo247.org, and winners will be selected at the sole discretion of Apollo 24/7 team. Gift vouchers will be shared with you if you have promptly written back to us with all the details before Wednesday of every week. Here are the 3 questions for this week. Question number 1 on the screen. Lifting dash objects can worsen the hernia. What is it? Fill in the blanks to make a word. Lifting dash objects can worsen the hernia. H-E blank blank Y. What is the word there? Lifting dash objects can worsen the hernia. Question number 2. Hernias only occur in men. Myth or fact? Hernias only occur in men. Myth or fact? Question number 3. Exercise can treat hernia naturally. True or false? Exercise can treat hernia naturally. True or false? Do please answer these questions on YouTube chat only. And here are the coupons that I'm going to give away, which you can use on Apollo 24/7, the app. The first one is code AskDoc150. You can get 150 rupees cash back on online doctor consultation. And when you consult top doctors direct from Apollo, you can use this code and get 150 rupees cash back as well. The next one that we are giving away is first 3, FIRST3, get 25% off on online medicine orders. You order medicine direct from Apollo and get a 2-hour delivery as well in all the other cities. By the way, let me tell you that Noida has launched a new campaign where there is a 19-minute delivery when you order medicines. And this is a successful campaign in and around Noida, which is stay tuned, which is going to spread to the other cities as well. Now you can get your medicines in 19 minutes when you order from Apollo 24/7. And the next coupon is exclusively for Health Hour viewers. Use the code HH247. Get 199 off on online consultation with Apollo doctors and 20% off on medicine orders as well. You can now contact Apollo 24/7 on WhatsApp as well. They're just a call away or text away, 9355247247. This is the number that you got to save to avail healthcare services. Let me also remind you that there are actually free virtual consults on Apollo 24/7, which are free. You've heard them right. Go on to the app, check for the virtual consults. You can get 3 virtual consults free on the Apollo 24/7 app. You don't need to use any code. You can just find them on Apollo 24/7. By the way, next week we are talking about sinus, how to cure sinusitis. That is October 20th, 11 a.m. Do join us for more information of how to take care of your sinusitis. And the winners for today are Pranita, Dasari David, and Sandeep. Pranita, Dasari David, and Sandeep. Please do write back to us and claim your health credits. And this is this week's episode. Next week मिलते हैं how to cure sinus के साथ. Do take care of yourself. Till then, thank you so much.